Hello, my name's Keon. I'm going to be your nurse practitioner today. What's your name and how old are you?
Jake, and I'm 18.
Okay, and I understand that you're here for your musculoskeletal exam?
Yes.
Okay, is it okay if I complete that exam on you today?
Yes.
Okay, so let's start by inspecting your fingers and your hands. Alright, so here I'm just looking for some swelling, redness, any type of nodules or deformities. I'm also making sure everything is symmetrical, which is also known as making sure everything is equal. So now what we're going to do is I'm going to do some palpation. I'm going to feel up here around your metacarpals, okay? Alright, and from there, you don't feel any pain while I'm palpating there. So now I'm going to check the distal portion of each finger, which is here. Okay, the distal portion. There. And now I'm going to check the proximal, which is right there. Your fingers. Okay. Alright, and now I'm going to check for your MCP joint, which is also known as your knuckle. Okay. Alright, so now let's do some range of motion in your with your fingers. Can you make a fist for me? Alright, can you flex them by pointing your fingers down? Alright, now can you point them up towards the ceiling for some extension? Great. So now I want you to take and move your fingers, spread them apart for abduction. Now close them for adduction. Alright, so now that we've done that, let's now move on and check your wrist. Alright, so like I said, I'm just inspecting for some redness, swelling, any types of nodules that you may have in your wrist area. Alright, checking for that. I don't see any swelling, redness, nodules, or anything like that. I don't feel anything. Everything looks equal. So now from there, I'm going to palpate Alright, so when I checked your fingers, I palpated your metatarsals. So here's your metatarsal area. And then here I'm palpating just to make sure that there's no atrophy or any type of nodules there. Any type of pain?
No.
Alright, so now let's check each carpal bone. So here we have your first carpal bone, which is going to line here. And then this here is your second carpal bone here. And then here, this is your third. And then this is your fourth carpal bone. And then here is your fifth, okay? So here you have your first, this is your second, third, fourth, and then your fifth. All right, so from there, now we are going to check out some of your, some range of motion that you have in your wrist. So what I want you to do is I want you to flex your wrist down like 90 degrees, and then I want you to extend up. All right, for extension. So now what we're going to do is I'm going to check for your ulnar and some radial deviation. So I'm going to adduct, which I'm going to point towards your body, and then I'm going to abduct, which I'm going to move away from your body. So we're going to do the same on each extremity. We're going to adduct, and then we're going to adduct, okay? Any pain with any of that?
No.
All right, so now let's do a couple of tests to check to make sure you don't have any type of carpal tunnel. So now what I just need you to do is hyperextend your hands like this. Good job. So now you're going to feel me palpating down the medial nerve, and then if you feel any type of pain or tingling or anything that radiates, that is a positive sign. Any pain or tingling?
No.
All right, that's good. Any pain or tingling?
No.
All right, that's a good sign. So next I'm going to have you stand up, and now I'm going to have you turn your hands down as if like you have some upside down praying hands, and now you're just going to feel me palpate the nerves. You don't feel any pain or anything?
No.
All right, let's do that down on the bottom part. All right, so the goal is that if you feel pain or any tingling, that would be a positive sign, but it's good that you don't. So I don't see anything with carpal tunnel. So next, now let's do an inspection of your elbow. All right. So now I'm just going to take a look at your elbows. All right. Making sure there's no redness, no nodules or any type of swelling there with each side, okay? I don't see any. All right. So now what we're going to do now is I am going to start to palpate, and here I'm just palpating to make sure you don't have any swelling or any type of nodules and or pain. Any pain?
No.
All right. Any pain
No.
in your elbow region? All right. So next what we're going to do is I am going to take and palpate down your extensor surface, which is down your ulnar side. So what we're going to do is I'm just going to palpate down. Any type of pain or anything there?
No.
All right, let's do that on this side. Okay. Extensor surface. All right. So now what we're going to do is I want to palpate some of your olecranon processes. So now that's actually like your elbow. So what we're going to do is I am going to palpate your epicondyle laterally and medially. So when I do it on your lateral, it's going to be on your thumb side, on the inside, that bone right there. And when that bone actually gets inflamed, that's known as tennis elbow. So it's very common in people that play tennis. So now I'm going to palpate your medial epicondyle, which is right here. And when that gets inflamed, that's usually common with your people that play golf and or play baseball. So now let's move to the other side. So here is your lateral epicondyle, and then here is your medial epicondyle. All right, any pain during those?
No.
All right, so now that we're done with that and we have now checked your epicondyles and everything seems to be normal there, now let's do some range of motion of your elbows. So let's flex your elbows in, let's bend them in. Great, and now let's extend them out. Great. So now let's do some superpronation and some pronation. So now what I want you to do is just hold your hands right out in front of you. So that is superpronation or pronation, and now we're gonna flip. Pronation, superpronation, pronation, superpronation. Great. So now that we're done doing that aspect of your range of motion, now we are going to move on, and now I'm going to now inspect your shoulders to make sure everything's symmetrical and that you don't have any abnormalities, any types of nodules or any types of swellings that I can see. And I'm going to take a look around your back as some parts of your shoulders extend to the back. And I don't see anything abnormal there, any type of nodule. So now what I'm going to do is I'm going to palpate. But when I was inspecting, I was also looking to make sure there was no atrophy or anything like that. So now I'm just going to palpate and just feel for any type of tenderness. Any type of pain?
No.
All right, so now I'm also feeling now to make sure there's no fluid filled up in your bursa sacs there, okay? So now what I want you to do is I want you to sit down, and I'm going to palpate your acromicrovicular process. So your acromicrovicular process is going to be right here. Let me see if I can feel it. All right, yep, right here, I feel that. Okay, and then down from there, coming down towards your arm, I'm going to fill in for your bicep groove. Okay, and now I'm going to come down and fill your tubercles of your humerus, which is going to be in here. Okay, and I'm going to do the same on this side, checking for your tubercles of your humerus. And you also know that your humerus, okay, that's good. So now I'm going to check for your coracoid process. if you just stand straight ahead. So that's going to come down, and that's going to be like right here, your cricoid process. All right. So now I want to assess your subdeltoid bursa, which is right here. This is the sac that's within your elbow. So if we bend, check right here. There you go. All right. Oh wait, your subdeltoid bursa actually, excuse me, is actually up here. So we're going to bend at the elbow, and it's going to be, you're going to bend that here, and then I'm going to palpate right in here. There we go. That's your subdeltoid bursa right there, right in here. All right, so let's do the same side over here. All right, right here, subdeltoid bursa. All right, so now what we're going to do is, if you can stand for me, we're going to do some range of motion of your shoulder. So what I want you to do is put your hands up over your head. All right, and that's flexion, and then now we're going to extend them backwards. So now let's do some abduction. So abduction, we're going to move your arm out to the side. Okay, let's do your other side. Abduct. And then we're going to bring it back down for adduct. So adduct, adduct across your body. There you go. Adduct. We're going to do the same thing on the other side. Adduct. So now let's do some lateral, let's do some internal rotation. And how we're going to do that is, I just want you to place your hands behind your head, and this is external rotation. And then now I want you to take your hands and put them behind your back, and that is going to be internal rotation. So now we are going to do a specialty test, and I want you to hold your arm out and act like you're dumping out a cup. There you go. Don't let me push your arm down. Any pain or anything there?
No.
Okay, so that test actually checks to make sure you don't have any rotator cuff tears or anything. So let's do this, your left side. I'm not sure if you're dumping it. Don't let me push your arm down. Great. Any pain there?
No.
Okay, so the rotator cuff appears to be intact. So now let's do your head and your neck. I can have you sit down now. So now I'm just going to check your neck and your head for any type of deformities, or any type of swelling, or any type of bulging, or any abnormal, anything like with abnormal posture. So if you can sit straight up, there you go. Posture looks good now, not slouched over. Everything appears to be aligned. So now what we're going to do is, I'm going to now palpate something called a TMG joint. And I'm going to find your earlobe or your tragus, and I'm going to come right there. All right, open your mouth. There we go. It's right here. Is your TMJ joint. Any pain or tenderness there?
No.
All right. So now I'm going to check your sternoclavicular joint, which is located, it's going to be right here, which is like right where your clavicle starts. Okay, so that's your sternoclavicle joint. So now I'm going to check your cervical spine, which is in your back part of your upper part of your neck here. That starts at the bottom of your occipital and extends to about right here. So I'm just going to palpate there for you. All right, don't feel anything there. So then I'm going to come behind you and I'm going to palpate your trapezius muscle, which is going to be on your left side. It's almost like a triangle here in this area here. So this is your trapezium muscle here, okay? So now I'm going to palpate your rhombus, which is going to be on your right side, and it kind of comes in like laterally, so like right in between here, which extends from C7 to about T5. All right, any pain or anything with that?
No.
So now what we're gonna do is I'm going to have you sit up on the tip of your chair, there you go. So now we're gonna do some range of motion. So let's flex your neck by tilting your chin to your chest. All right, now let's go back to normal. And now let's extend back like you're looking like at the ceiling. Great. So now what we're gonna do is we're gonna do some lateral movements. I want you to take your left ear and touch your left shoulder. And then I want you to take your right ear and touch your right shoulder. Great. So now what I want you to do is I want you to open up your mouth. You should be able to take 3 of your fingers and place them in your mouth vertically. Great. All right. So now that we've done that, now let's do the Sperling's test. We're just going to test for some cervical compression. So how we're going to do that is I'm going to come behind you, and I just want you to put your right ear to your shoulder, and I'm just going to press down. Any pain?
No.
All right, let's do your left side. Any pain?
No.
Okay, good. So I didn't feel any decrepituses or anything like that. So now that we've completed that, let me take a look at your feet. So I'm going to inspect your feet, and I'm just checking to make sure there's no deformities. Everything's everything's symmetrical, and you don't have any swelling, deformities, any nodules. So now can you lift up your foot? Now I just want to take a look at the bottoms. I'm just checking to make sure there's no plantar warts or anything like that. All right, so now let's do some palpation. So now I'm going to palpate here, your metatarsals. Okay, in this area there, your metatarsals. All right, so this is the distal part of your toe, and this is your proximal part. So distal, and then proximal. All right, distal, proximal. All right, so now that I've done that, now I'm going to check to make sure that you don't have any types of distal neuromas. And those are just inner types of swelling that's located within your nerves of your foot. I don't feel any interdistal neuromas. All right. Check this side. All right. I also don't see any bunions or anything on your feet. So now, do you have any pain in this area here?
No.
All right, so you don't have any plantar fasciitis. Check this. Any pain in this area?
No.
Okay, so no plantar fasciitis there. So now that we've checked that, now let's do some range of motion. So are you able to hold your foot up in the air for me? Can you curl your toes? All right, so when you curl your toes, that's flexion. So if you extend them back out, that's extension. So let's do the same one on your left side. Curl your toes for flexion and extend them back out for extension. Okay, so now let's do some internal rotation and some external rotation of your foot. So now let's take and we are going to, let's turn your foot in for invert. Turn your foot out for extension, okay? Let's do the same one there. Let's turn your ankle in and then out. So internal, external. Great. So now from there, I'm going to take a look at your ankles while I'm done because I'm done doing your feet and your toes. Checking for any types of deformities, swelling, redness, making sure everything's symmetrical and equal. Checking behind, looking at that Achilles. Okay, and now I'm going to now palpate your ankle, and I'm checking now for any deformities or any type of nodules or any pain. Any pain or? No. All right, I don't feel any type of nodules or anything there. So now what I want to do is I'm going to palpate your medial and lateral malleolus. Okay, so how we do that, so your medial malleolus is this bone right here. Okay, this bone right here on your left side. Your lateral malleolus is this bone here on your left side, and it's going to be this bone here on your right side. All right, so now that we've palpated your malleolus, is now that I want to do some dorsal flexion. So what I'm going to have you do is flex your foot down, and then I'm going to have you extend it back up. So dorsal flexion and extension. There we go. Let's do your left side. Yep, and then flex it back up. All right, so now that we've done that I've had you do it, which is active range of motion, and I'm going to do passive range of motion, but are you able to turn your foot and your ankle in a circle? All right, go ahead and do your left side. All right, so now let me do my part. Okay, so dorsal flexion, extension, rotation. Okay, dorsal flexion, extension, rotation of that ankle. Great. All right, so now that we've done your ankles, now let's do some of your knees. So right now I'm just going to have you bend your knees. There you go. And now I am just going to inspect. I'm just checking to make sure there's any type of deformities, no swelling, any types of nodules. And I'm going to take a look behind your knee, make sure there's nothing bulging or anything from there. So now what I'm going to do is I'm going to now palpate something that is called your patella pouch, which is going to be right here. Okay, come down right here. It's your suprapatellar pouch. All right, now I'm going to palpate both sides of your knees. Any pain?
No.
All right. Any pain?
No.
All right, now I'm going to palpate the back of your knee in that popliteal fossa area, which is Baker's sister known back there, so I don't feel any cyst. All right, I don't feel any cyst there. All right, so now let's do some passive and active range of motion on your knee. So what I'm going to have you do is I'm going to have you straighten your leg out, which is extension, and then we're going to bring it back in for flexion. There you go. We're going to do the same side. We're going to straighten your leg knee out, and then we're going to bring it back in. Great for flexion. So now I'm going to do it for passive. So straighten out for extension, bending for flexion. All right, so I'm going to straighten out the knee for extension and bend for flexion. All right, so now that we're done with that, now I'm going to do a couple of specialty tests. So I'm going to actually need you to come over onto our bed here and lay on your back. All right, so now what I'm going to do is I'm going to place your knee in about 20 degrees right there, okay? And then I'm going to take my lateral hand, and then I'm just going to move abductally, okay? Now I'm going to switch. And then I'm going to move and do adduct. All right, so then I'm going to do the same over here. So I'm going to adduct, and then I'm going to adduct, okay? All right, so now that we've completed the vagus stress test, I didn't find anything abnormal there, but that test actually checks to make sure you don't have any meniscal tears or anything like that. Did you have any type of pain or anything with that?
No.
All right, so now what we're going to do is I'm going to come down to the end. I'm going to flex your knee or bend your knee at about 20 degrees again, and I'm going to do a test called the Lachman's test. So what I'm going to do is I'm going to hold your tibial and I'm going to pull anteriorly. So I'm checking for that MCL, and now I'm going to push back, checking for that PCL. All right. So forward for the MCL, push back for the PCL. So that's your Lachman's test. So next I'm going to do your drawers test. So what I'm going to do is I'm going to come around and I'm going to sit on your foot and I'm going to pull anteriorly to assess that MCL, and I'm going to push posteriorly to check the PCL. Any type of pain with that?
No.
All right, so now I have to do your other side. So let's go ahead and switch sides. All right, so I'm gonna bend this to about 20 degrees and I'm going to sit on there. Okay, and I'm gonna pull anteriorly. Any pain?
No.
And any pain posteriorly. All right, good. So I don't see any issues with your MCL or your PCL. So now the very last test that I want to do is called the McMurray's test. So what I want to do with that is you can stay in this position. I'm just going to hold your leg up here and I'm just going to rotate it. Any pain?
No.
All right, if I can have you come up to this end of the bed so that I can assess your right side. All right. All right, any pain?
No.
All right, so that's good there. So now that we've checked your knees, so now what we're gonna do is I'm gonna have you stand up and I can have you come over here. I'm gonna actually assess like your hips now. So just stand straight. I'm looking to make sure you don't have any deformities or anything in your hips. Coming around and checking your back part. Make sure there's nothing there, no swelling or anything like that. I don't see any nodules. So now that I've inspected, now I'm gonna do some palpation, okay? So just gonna do some palpation. Feeling for all your different types of joints. All right, I don't feel any type of swelling or anything. Everything appears to be lined. So now I'm going to palpate your intertrochanter hip, which is going to be right here. All right, any pain or any tenderness there?
No.
All right, so now here is, down when you come here is going to be something called your superiliac spine here. It's more down, moving towards your pubis here. And then inside here, like the crease area here, is going to be your sacroiliac joint. Okay. So here, back in this area, this actual hip part here, is your ASIS, which is also known as your anterior superiliac spine, okay? All right, so now what we're gonna do is we're gonna do some range of motion and passive range of motion in your hip. So what I want you to do is, if you can sit down. All right, and now I want you to bend your knee at about 45 degrees, which you have, okay? And then I'm just going to assess. So now what I want you to do is I want you to move your foot out. All right, now move it towards in. All right, So when you move your foot out, we are checking for your internal rotation of your hip. So out, okay, that's rotating in your hip, and then when you move it in, that's external rotation of your hip. Okay, so let's move this foot out to check for that rotation of your hip, which is going to be internal, and then we're going to move it inwards to check that external portion of your hip. Any pain when you did that?
No.
All right, so now what I want you to do is I want you to move your leg, like move your, well, we already did. Let's do some abduction and adduction. So now what I want you to do is move your leg out for abduction, move it in for adduction. Let's do the same thing with this one. Move your leg out for adduction and move it in for adduction. Great. So now that we've done those and we've checked part of your hips for abduction and the range of motion, now let's do a specialty test for your hips. So for that, I am going to have you do the Thomas test. So if I can have you come lay down. And after we do the Thomas test, we are going to do the Patrick's test. So what I'm going to have you do is I'm going to have you bend your knee. And I'm going to have you grab your knees with both your, and I'm going to have you pull towards your chest. Any pain or anything like that?
No.
All right, let's do your other side. And that there is the Thomas test. And that actually, when you do that, it actually will flatten your lumbar lordosis. So if there wasn't any pain with that, that's good. So now what we're going to do is a test called the Patrick's Faber's test. So what we're going to do with that is I'm going to check your hips for any type of hip disease or anything like that. So what I'm going to have you do is I'm going to have you sit up, and I'm going to have you take your left leg and put it across onto your right. All right, and I'm just going to push down. Any pain?
No.
Okay, now let's do the opposite side. All right, I'm going to come over here. Any pain?
No.
All right, and that's your Fallon's test. So now that we're done doing those, let's take a look at your spine. So I'm going to ask you to come, and you can actually stand right in front of me. And now I am going to have you turn towards the wall. Okay. And now I'm just inspecting the cervical area, up in this area, and then we're going to come down towards the thoracic. Then I'm going to move down towards your lumbar, and then your sacral, and then your coccyx. I'm just making sure that you don't have any deformities, nothing's swollen or anything like that. And I don't see anything. Everything appears to be normal. So now what I'm going to do is check to make sure your shoulder height is all even, and make sure that your iliac crest, which is down here, is all even and symmetrical, and everything looks good while you're standing there nice and tall. So now what I'm going to do is I'm going to inspect your dorsal lumbar. So I need you to just bend over slowly. Okay, and now, okay, you can come back up nice and slow. And that's just checking to make sure there's no kyphosis or lordosis or anything like that, and everything appeared to be normal there. So now, and everything was symmetrical. So now if I can have you back up a little bit. So now what I want you to do is I'm going to have you bend forward and flex your back. So if you can just bend over, there you go. And then if you can come back up. So then I want you to inhale and stretch your shoulders. Yes, bend backwards for some. You got that nice curve. Okay, we're good. So now you can bend forward as you did your flexion. Okay, so now that we're done with that, so now what I want you to do is I just want you to have you bend over as far as you can. If you could touch your toes. Like I said, I'm just going to make sure that you don't have any type of deformities in your back. So can you bend over and touch your toes? Okay, everything looks symmetrical there. I don't see anything off. So next, what we're going to do is I'm going to have you stand straight up. So now I'm going to have you face me. And now I'm just going to palpate some of your spinal processes in your spine. So up here is your cervical spine, and then as we move down here, we have your thoracic spine, and then as we move down here, we have your lumbar spine, and then as we move down here, we have your sacral, and then as we get on closer down here is what is called your coccyx, which is also known as your tailbone. While I'm actually inspecting, I would be looking at your buttocks line and stuff, but due to the video, I'm not going to do that. So I just visual lined. I make sure that your buttocks, your line is equal and symmetrical. So now what we're going to do is now I'm going to palpate in between each one of your vertebrae, and that's called your intervertebral disc. And that's the portion that most likely gets herniated when you hear people say they have a herniated disc. It's in between your vertebrae, okay? All right, any pain?
No.
All right, that's good there. All right, and then that goes all the way, you can palpate from your cervical all the way down to your coccyx. All right, so now that we're done doing that, I am going to actually have you do some range of motion. All right, so if I can just have you turn, like bend over towards your left. Great. Any pain when you did that?
No.
All right, now I'm going to have you bend over to your right. Any type of pain there?
No.
All right, so now what I want you to do is I want you to twist your shoulders. There you go, and if you can do the other side for me. Great. So now while you're in this position, let's check and do a specialty test, and this one's fairly easy. All I need you to do is raise your leg straight out in front of you. Great, move it back. Now let's do the other side. All right, now I can have you sit down. All right, during your exam, did you have any type of pain or anything like that?
No.
All right, I didn't feel anything abnormal when I was doing your assessment. Everything appears to be normal from what I saw. So that's actually going to conclude our musculoskeletal exam.